Morning everybody. Today we will be discussing Kuhs Community Medicine Paper 2, September 2016, question paper answer key discussion. So here the questions are not there. So I will read from other way. Essay 10 marker question. Asha, a 6 years old child, is brought to the primary health center with fever for 3 days and the tourniquet test is positive, indicating the probable case of dengue. You should understand that tourniquet test is done for dengue. What investigation will you do? How will you manage? As a medical officer, what actions will you take to control the disease of the community? A case of dengue hemorrhagic fever. Dengue hemorrhagic fever, first category, dengue hemorrhagic fever, febrile phase is this category. Investigation, blood routine examination, hemoglobin, total count, differential count, the ESR, the platelet count, hematocrit value you should investigate. Confirmation diagnosis, viral detection and its components, viral isolation, mosquito cell culture inoculation, nucleic acid detection by RT-PCR or real-time RT-PCR, antigen detection by NS1 antigen rapid test. Any one you should remember, or NS1 antigen ELISA or immunohistochemistry. Serological response, IgM or IgG seroconversion, ELISA or HIV or neutralization. IgM detection, you should use ELISA or rapid test. IgG detection, IgG, ELISA and HIV. Then clinical management, clinically assess the case and manage with ORS or IV fluids. Symptomatic management, antipyretics, avoid aspirin and other NSAIDs. Hospitalize if no clinical improvement or deteriorates. Healthcare providers should monitor the case daily. And as a medical officer, I would promote and implement at community, family and individual level the following measures. Mosquito control like anti-adult measures, anti-larval measures, other measures, isolation under bed nest, personal protective measures and environmental measures. Vaccine so far is not available in India for dengue, but available in some countries. Dengue vaccine. Then antenatal. Then second question. 18-year-old Anisha, a primi gravida with 4 months amenorrhea for checkup. How will you proceed with clinical examination and management? It is a 5-mark problem-based question. So it is antenatal checkup, history taking, physical examination, abdominal examination, assessment of the gestational age, laboratory investigation at subtenant and at the PSC, CHC or first referral unit, investigation and counseling, prenatal advice, menstrual IG, then family planning. Then a case of 4 months of old Priya go to the primary health center with fever and 4 months old Priya is brought to the primary health center with fever and cold for 3 days. She is alert and her respiratory rate is 58 per minute. Grunting is present. How will you classify her diagnosis and what treatment will you give? It is a case of pneumonia, fast breathing with no chest in drawing. Management advise mother to give home care. Treat if fever or wheeze is present. Start antibiotic. Co-trimoxazole is the drug of choice for pneumonia. Reassess after 48 hours. Then preventive measures you have to take to prevent the pneumonia. Then next question is another 4-mark question. Vision 2020. The right to sight. It is a global initiative to eliminate avoidable blindness launched by WHO in 1999. Avoidable blindness due to malnourishment, infectious or traumas. Concept and objective, plan for action for India and its features. Then laboratory diagnosis of cholera. So laboratory diagnosis, collection of samples and transport. Diagnostic test is by direct examination, culture method, characterization, biochemical test, further characterization, agglutination of test, negative look for oxidase and string test. Then prevention of rheumatic heart disease. Aim to prevent further attack of rheumatic fever. Early diagnosis, lab facilities, lot of in apparent infection also. Identify all streptococcal throat infection and treat with penicillin. High-risk group, school children kept under surveillance, prophylaxis, benzathine penicillin IM or oral penicillin for 10 days. If allergic, erythromycin can be used. MCH and school health services can be used. Problems are impossible logistic and financial constraints. Then package of services under National AIDS Control Program. So in ACP 4 package of services, preventive services, then care, support and treatment services are there. Then adolescent friendly health services, AFHS, adolescent friendly health service. Part of adolescent health program, facility based health services, reorganizing the existing health system to meet the needs of the adolescent, routine checkup at primary, secondary and tertiary levels on fixed days, provide services, information and commodities, address the varying needs, contraceptive menstrual, reproductive tract infection, sexually transmitted infection, antenatal care and anemia. Differentiate between PERT, program evaluation and review technique and the critical path method. It is the component of network analysis in quantitative methods of management. Program evaluation and review technique, definition and activity, critical path and definition, activities and importance. Anganwadi worker and ASHA. Anganwadi worker is program selection and training and duties. Accredited social health activity. Accredited social health at ASHA. She also has some program selection, training and duties. During and after floods. During floods, activities. Drought strategy can reduce the burden of tuberculosis. Droughts category you should read separately. Droughts category is direct, observed, short course. It is a very effective if it is properly implemented and the TB load will be reduced. Surveillance has to be imposed for ABR is less than if ABR is less. Annual blood examination rate is less than 10 million cubic area of malaria. ABR. And the APA surveillance strategy, important strategy for prevention and control of malaria. Then elements of primary health care, education, concern prevailing health problems and methods of preventing and controlling, promotion of food supply and proper nutrition, adequate supply of safe water and basic sanitation, maternal and child health care including FP. Immunization against major infectious disease, prevention and control of local endemic disease, appropriate treatment of common disease and injuries, provision of elemental drugs, modifiable risk factors of HT, hypertension. One is obesity, salt intake, saturated fat, dietary fiber, alcohol, heart rate, physical inactivity, environmental stress, socioeconomic status, noise and vibration. Then once are the mental health services. Mental health services include early diagnosis and treatment, rehabilitation, group and individual psychotherapy, mental health education, use of modern psychoactive drugs, aftercare services. 17th question is health related Millennium Development Goals. Goal 1 is the eradicate extreme poverty and hunger. Goal 4, reduce the child mortality. Goal 5, improve the maternal health. Goal 6 is treatment for HIV, AIDS and malaria. Goal 7, ensure environmental sustainability. Develop the global partnership for development. And responsibility of the WHO, prevention and control of specific disease, development of comprehensive health services, family health, environmental health, health statistics, biomedical research, health literature and information, cooperation with the other organizations.